Surgical extrusion is a dental procedure that involves repositioning of a tooth to more coronal position or supragingival position within the same socket. Another term is extrusive luxation to explain surgical extrusion, considered to be a treatment modality for crown root fracture as per 2020 International Association of Dental Traumatology guidelines. The advantages of surgical extrusion includes shorter treatment duration, minimal bone loss, preservation of interdental papilla, minimized coronal migration of the supporting tissue, and cost effectiveness compared with other treatment modalities such as orthodontic extrusions. Despite the complications that were linked with the procedural errors that compresses the periodontal ligament fibers or involve improper root manipulation, the existing literature on surgical extrusion mainly consists of case series and case reports, which are considered low evidence due to the difficulty in establishing definitive causal relationship between the intervention and the outcome, leaving a room for this group from India to publish their trial or their clinical study by the Australian Endodontic Journal in 2024 with the title Survival Evaluation of Surgical Extrusion for the Management of Complicated Crown Root Fracture Maxillary Incisor, a Clinical Study, aiming to evaluate the survivability of surgical extruded teeth using minimally traumatic extrusion technique, assess the success rate, and identify the predictable factors related to changes in the hard tissue and the soft tissue adjacent to the extruded teeth. In their methodology, this single-centered, non-inferiority clinical study was conducted between June 2019 to August 2023 in the College of Dental Science and the Research of Midori. A sample of 41 patients, 46 teeth, with complicated crown root fracture, maxillary central and lateral incisor, with an age range between 13 to 70 years old, following their inclusion criteria, which are maxillary incisor with insufficient ferrule height less than 2 mm, crown root ratio less than 1 mm, subgingival extension of the fracture line, teeth with discoloration or preapical pathology, and non-smokers. And they excluded periodontally compromised teeth, patients are not willing to come to recall visits, patients with systemic disease hindering the treatment. Their variables: teeth structure loss, ferrule height, radiographic assessment following the standardized paralleling technique, crown root ratio, gingival index and probing depth, and interproximal papilla volume. The endodontic procedure were carried on followed by the surgical procedure using a minimally invasive technique involving a gentle luxation and controlled rotational movement for the coronal repositioning with a semi-rigid passive fiber reinforced splint and a flowable composite and a post-operative instruction. The restorative procedure was done after 2 weeks after removal of the splint with a composite incremental technique for the final filling. The follow-up in the outcome assessment, follow-up period mean of 20 or 2.8 years, range between 6 months and 4.5 years, intervals 6, 12, 18, and 24 months, and also 36 months. Their assessment were clinical and radiographic assessments, and the statistical analysis were for the clinical parameters using Wilson-signed rank test, and for the crown root ratio, Friedman test, and for the survivability or the survival Kaplan and Meyer survivor analysis. Their findings revealed out of 46 teeth treated with surgical extrusion, 31 males and 15 females, average age 30 years old, and 29 maxillary central incisor and 17 maxillary lateral incisors, all teeth had more than 75% structure loss. In figure 5, it represents the mean of ferrule height in millimeter before the surgery, averaging 1.42 millimeters, And after the surgery, the furrow has been increased to 3.86 millimeters. Figure 6 represents the frequency distribution of preoperative and follow-up crown root ratio after surgical extrusion. Before the surgical extrusion, the crown root ratio was favorable, 1 to 2, for all cases and 41% of all the cases. However, at the first year follow-up after the extrusion, 5 teeth showed unfavorable crown root ratio 2 to 1 and 1.5 to 1. Figure 7 represents the GEMET index that represents or measures the periodontal ligament or the gingiva around the tooth. A score of 3 in all cases, except 2 cases with gingival hyperplasia with a score of 4. So the overall survival rate for surgically extruded teeth from this study and the coronal-radicular direct composite restoration was 95.7% in 2.8 years, respectively, and the success rate was 89.1%. In conclusion for this study, the surgical extrusion is a safe, effective, cost-effective, preserving, functioning, and also aesthetic with a high success rate and survival in 2.8 years. However, further research is needed to explore the long-term survival involving a larger sample size and extended follow-up period. This study seeks to determine the tooth outlasts the patient expected lifespan.